Some of the most intricate and delicate surgery is surgery performed on the brain. But technological breakthroughs are now assisting doctors with pinpoint accuracy. We spoke with neurosurgeon Dr. Derek Duke and asked him about the Vector Vision system from Brainlab.
It's a system that we use to quite simply take the guesswork out of neurosurgery. Back many years ago, people would have to use anatomic landmarks on the skull in order to determine where to put an incision to take out a brain tumor or remove a blood clot or perform some other type of neurosurgery. Nowadays, we use the power in computing to make those decisions for us. Basically, what it does is it allows us to take the preoperative imaging, such as an MRI or a CT, and download that into the computer to allow us to know exactly where the tumor is with respect to the outside surface of the skin and scalp and skull. So what it does is allow us to very precisely make an incision in just the correct area so that we can be right over a tumor or other type of lesion and remove it without disturbing normal brain tissue. Prior to surgery, we actually obtain a very high quality MRI. That very high quality MRI is then downloaded into the Brainlab package. From there, we actually go through the images, we identify the lesion, and we plan our trajectory, which is what approach we want to take in order to take out the lesion. After that's planned, then at the time of surgery, we scan the patient into the package using a laser. We scan this over the patient's face while they're asleep. It's a very low power laser, so it doesn't cause any type of burns, but it basically creates a three-dimensional image of the patient's surface anatomy, which then is correlated to the preoperative MRI. After that, then we can see exactly where we are in space with respect to the tumor or other lesion. Basically, we use a probe that has light-emitting diodes on it that go to separate cameras within the operative suite that triangulates where we are with respect to the lesion. This is what gives it its pinpoint accuracy and benefit to us. So after the patient's completely prepped and draped and asleep, and we've scanned them into the software, you have a monitor that has a three-dimensional display of exactly what anatomy is being pointed to by your probe during surgery. So as you make your incision, you simply take the probe and you overlay skin or other structure that you want to identify, and it shows you in 3 dimensions what that structure is in relationship to the rest of the anatomy and makes it very easy to identify. As you go deeper, you can tell when you've completely resected a tumor because the 3-dimensional display will show you when you've reached the back end of the tumor and there's no guesswork about when you're finished. We've taken technology that's been developed at multiple tertiary care facilities throughout the country, and we've taken the best of these programs and combined them into a very strong neurosurgery program that has the Brainlab system as its foundation. We've been very, very pleased with the results with the Brainlab system. It's greatly shortened operative times, it's increased patient safety, it's decreased the infection and also the complication rate associated with neurosurgery, and so all around we're very, very pleased with the product. There was a patient recently that we used the Brainlab system on. It was a middle-aged woman that had a tumor in her brain. The location of the tumor was in the temporal lobe, which controls speech, and therefore you have to be very careful when removing these tumors not to affect any other surrounding brain tissue, as you don't want to cause any difficulties with speech. The system allowed us to make an incision and perform a craniotomy right over the lesion and perform the surgery and remove the tumor without any injury to the surrounding brain. Because of this, she was able to have her surgery and not have any difficulty with speech post-operatively. The most rewarding part of my job is helping patients get over very difficult problems with as little risk as possible. Having good outcomes is the primary objective, and that's the most rewarding part of my job.